Among vitamin B12's many quiet contributions to health, its role in keeping bones strong and resilient is one of the most surprising and least appreciated. While calcium and vitamin D usually take the spotlight in discussions of bone health, mounting research shows that low B12 levels can silently erode bone mineral density, setting the stage for osteoporosis and fractures, particularly in older adults who are already vulnerable to falls and skeletal fragility. The mechanisms connecting B12 to bone health are multifaceted and fascinating. First, B12 is critical for homocysteine metabolism through its role as a cofactor for methionine synthase. When B12 is insufficient, homocysteine levels rise, a scenario well documented to harm vascular health, but also shown to affect bones. Elevated homocysteine disrupts the formation of collagen crosslinks in the bone matrix, weakening the microarchitecture of bones and making them more brittle. It may also induce oxidative stress and inflammation within bone tissue, further compromising structural integrity. Beyond homocysteine, B12 appears to directly influence the activity of osteoblasts, cells that build new bone, and osteoclasts, cells that break down bone. Animal and cellular studies suggest that B12 deficiency impairs osteoblast proliferation and function, tilting the balance toward bone resorption rather than formation. This subtle shift can gradually reduce bone density over years, long before overt osteoporosis or fractures appear. Human studies provide compelling support for this link. Large cohort analyses have found that older adults with low serum B12 or elevated homocysteine have significantly lower bone mineral density and a higher incidence of hip, vertebral, and other fractures, even after controlling for factors like calcium intake or physical activity. Some interventional studies indicate that B12, often combined with folate and vitamin B6, can lower homocysteine levels and potentially slow bone loss, though the evidence for fracture prevention remains mixed and warrants further research. What makes B12's role in bone health especially mysterious is that its impact often unfolds silently. Many older adults or individuals with malabsorption issues may show no classic signs of deficiency, like anemia or neuropathy, yet still experience accelerated bone loss. Risk factors such as advanced age, vegetarian or vegan diets without B12 supplementation, chronic gastritis, or long-term use of proton pump inhibitors can quietly drain B12 stores, undermining skeletal strength in ways neither patients nor clinicians suspect. This hidden risk takes on even greater importance considering that fractures in older adults can trigger a cascade of complications, from loss of independence to increased mortality, that dramatically shorten lifespan and quality of life. By recognizing B12 deficiency as a modifiable risk factor for osteoporosis, we gain a powerful, underutilized tool to protect skeletal health as we age. The hopeful message is that correcting B12 insufficiency can be straightforward. Simple blood tests for B12 and homocysteine can identify at-risk individuals, and replenishment through diet, oral supplements, or injections can restore sufficiency. Ensuring optimal B12 intake, especially in older adults or those with risk factors for poor absorption, may not only protect the nervous system and cardiovascular health, but also preserve bone density, adding another dimension to the vital importance of this often overlooked vitamin. Ultimately, the impact of B12 on bone health is a reminder that our skeleton is more than an inert framework. It is a dynamic, living tissue influenced by subtle biochemical processes. By appreciating and supporting the quiet work of B12, we can build stronger bones and a more resilient foundation for healthy aging.